Hello everyone, I am Dr. Chengappa KG. I am a consultant rheumatologist and immunologist at Rheumacare, Mysuru. Today, I am going to discuss an interesting topic called gout. So let us try and find out what gout is. Gout is an inflammatory condition and it causes arthritis. So gout happens because the uric acid levels in the blood goes up to a very high level, and this will cause crystallization of this uric acid, and then these crystals get deposited in your joints. Once this happens, there is intense inflammation that occurs, and then this will lead to very bad pain, redness, swelling of the joints. So overall, if you see, gout is an inflammatory condition which is manifested as arthritis, which is because of deposition of uric acid crystals in the joints. Now, coming to what are the symptoms and signs of gout, as I already mentioned, gout can have arthritis, that means inflammation in the joint. So, if we see what are the joints that are involved usually, these are the joints of the foot, mainly the first metatarsal joint that we call, the joint that is involved in your great toe. So, this is the commonest joint that can be involved. Having said that, this is not the only joint that can be involved. There can be other large joints also that can be involved, like the knee, ankle, midfoot, and very rarely the upper limb joints also. So, if you come to the symptom is quite dramatic in most of the people. What happens is there is a sudden onset of pain. By evening there is some gradual pain in one joint, and by midnight it becomes so bad that it wakes you up from the sleep and then does not let you sleep. The pain is so bad, the swelling is so bad, and also there is redness. So there is actually an explosive onset. And then what happens is, if you treat it or you don't treat it, this joint pain starts to fade off on its own. And over 1 week's time, it actually disappears. And then it gives you a break for maybe 1 or 2 months, depending on grade at which your gout is at. And then again, the same thing happens. So, this gout, as I told, is an episodic inflammatory condition that happens all of a sudden. It causes very bad arthritis, disabling, and then over a week's time, it goes off on its own. And then again, after a few months, it comes back. So, this becomes an episodic inflammatory cause. So, we understood what the symptoms of gout are. Sometimes there can be, in advanced cases, there can be lumps of uric acid crystal that are deposited in your legs or your elbow joints. These are called tophi. And these tophi sometimes can ooze out chalky-like material, and these are nothing but uric acid crystals. If we take this chalky material and see under the microscope, we see needle-like uric acid crystals. So these are all very advanced cases of gout that causes tophi. So two main symptoms, if you say, episodic arthritis and rarely tophi. Now the next logical question would be, doctor, who gets gout? Who is at risk for gout? So I must say that people who are at risk are mainly men. Or if it is women, they are mostly postmenopausal women. Other than this, premenopausal women usually do not get gout. So mostly men, as I said, those who have postmenopausal women is the second this thing. And those people who have a kidney disease where they might need dialysis or they might not need dialysis also, but their renal function is impaired, even they are at risk of gout. Other than this, in the general population, if you see, people with abdominal fat, means abdominal obesity, with diabetes, and with high BP or hypertension, these are the people who are at higher risk of gout. Beside this, there are certain medicines also that can cause increased uric acid and ultimately result in gout. And the commonest one is the diuretic medication that we give in for hypertension. So even these medications can cause increase in uric acid and then eventually into gout. So the next logical question is, doctor, how do you diagnose my gout? As I already said, any rheumatologist can diagnose your gout with 70% surety based on your clinical findings itself. We already discussed how dramatically this arthritis comes and then it goes, gives you an episode of, without any symptoms and then comes back again. This history itself is so classic that most rheumatologists can pick it up, saying that, okay, this is very typical of gout. Then, to confirm this, they might want to do your blood levels for uric acid, especially during the time when you don't have arthritis. This is when the uric acid is likely to be higher. Then, to confirm it, because some cases can be really confusing, to confirm this, sometimes the rheumatologist would aspirate your knee when there is acute arthritis and then look for crystals of uric acid. So this also is a confirmatory test for gout. Other than this, we can also do some imaging tests. We can do something called a dual energy CT or a simple ultrasound, where ultrasound can show the deposition of these uric acid crystals on the cartilage, and also it can show some erosions, which are very typical. Very rarely X-rays can also pick up typical erosions of gout, which can also be quite confirmatory. Once we have diagnosed, the next question would be, how do we treat gout? So treating gout is not just treating the uric acid level, it is treating the patient. That is because we know that these are individuals with some other risk factor. It could be abdominal obesity, it could be a heart failure, it could be BP, high BP, or it could be a kidney disease, one of these, or maybe they have a very strong family history, something like this is there. So I would first ideally want to do a lot of dietary and lifestyle modification for this individual. What are the dietary modifications that we could do? We will discuss in a subsequent section. But overall, what we want to try and avoid is avoid sweet, avoid aerated drinks, avoid red meat and seafood if possible. So all this put together will give us about 1 gram decrease in the uric acid. If we do it very strictly, it can reduce our uric acid levels by 1 gram. But then, as a rheumatologist, my goal of treating you is twofold. So the first goal is to bring down the uric acid levels to less than 6, and the second goal is to prevent flares of gout. That means prevent flares of this arthritis again and again. So to bring down the uric acid level, we mainly have two medicines in India. One is allopurinol, another is febuxostat, and your rheumatologist would definitely treat you to target, and the target being a uric acid level of 6 or below. And then to prevent the flares, what we have is something called colchicine. Sometimes normal painkillers can also be used, and sometimes steroids, low dose steroids can also be used if we are not able to use the other two medicines. All this is assuming that the person has not come in a state of acute very bad arthritis. If somebody comes with a acute disabling very bad arthritis, we would want to control pain first, and this can be done via various measures including intra-articular injections, intermediate dose of steroid for very short duration, painkiller, or even advanced biologics like canakinumab, which are currently not available in India. So once the acute episode is controlled, we go back to our original plan of treating to target. The goal being uric acid of 6 or below and not having repeated flares. And this is how any rheumatologist would treat you, beside advising you very good lifestyle measures. So gout seems to be very dramatic, quite painful, quite disabling. But it also gives us a second chance. It comes and goes and gives us a second chance. And this is a chance as a patient we should embrace and make sure your rheumatologist treats you right and gets you under adequate control and probably try and cure your condition. So gout, though it is painful, it gives us the window of opportunity to be treated very well. Please do not miss this window of opportunity by not following up with your doctor.